Hey, good afternoon, everybody. We're going to start in about a couple minutes. We're still waiting for a few people to load on. I can see that they're still in the lobby, just loading on. We have a few people that are on our telephone line as well. They're just going to listen in today. So we're going to start off in about 2 minutes here. We're going to go our MyoStretch therapy, working on the massage gun and how to actually use and incorporate the massage gun into your practice. So welcome, everybody. Let's get started. You should be able to hear my voice and see a PowerPoint in front of you that says MyoStretch Therapy webinar in July 2019. We know it's August 2019, but the content was the same from the time we did last month and to this month. So today we have a lot of stuff that we're going to go over. If you do miss any of the information, we are recording it today, so you can go back and listen to it. We will send out that link about half hour to an hour, depending on how long it takes to upload. We'll send it out via a private YouTube link as well. So just a little bit of a background here. We're going to go through a couple of points just before we dive deep to the information. So if you're unfamiliar with our company, we're the M2T Blade, which stands for Myofascial Mobility Tool. We develop products in education like the M2T Blade, which is an instrument-assisted soft tissue mobilization tool, custom kinesiology tape, and the M2T Blade massage gun, which is a new massage gun that we have out there as well. Our whole goal as a company is not just to create products. We're more based on an education company. We're going to talk about that today. One of the biggest trends that we're seeing is massage guns. If you're on Instagram, if you're on Facebook, you'll see the explosion of different kind of massage guns out there. So in our webinar today, we're going to talk about, do massage guns work, how you can incorporate it, and how you can actually use it in your practice to get better results. We're not saying that massage guns are be all end all. We're not saying that they're bad either. It's part of a process, they're part of a tool. Just like kinesiology tape, just like the M2T Blade, which is an IASTM product, is a tool. It's not the be all end all. One thing that we're seeing a lot on Instagram and Facebook and social media channels is that everybody from fitness trainers, physical therapists, chiropractors are using massage guns as a massage technique. I was at a conference last weekend and I saw practitioners and trainers offering massage gun treatments for a fee. So all they do is massage gun treatments and charge a straight fee. Now, what we're going to talk about today is how to assess, how to correct, and how to treat properly. We don't want to just apply massage guns to the actual area. We want to actually figure out how we can apply proper techniques at the proper settings to get the most bang out of your buck and how to get the best treatment possible. So a little bit more. So just about our company, if you're not know, so you can always go to the m2t-blade.com. We're the developer of the M2T Blade, Vigor Connect Tape. We have 2 warehouses. We have one in Hamilton, Ontario. We just opened it up off Sherman Avenue North, just outside of downtown Hamilton. We also have another one for Australia, Southeast Asia, and India, which is based in the Philippines. Our whole purpose is we want to develop a course on proper utilization of the M2T, corrective and mobility exercise selection, and integration into your practice. So here's a little bit about what we're going to talk about today. This is the massage gun that we launched in May 2019. We just did a video last night of the differences. So one of the questions that we get, and we'll talk about this a little bit later in the actual webinar, is how loud the massage gun actually is. So again, there's some products out on the market that are extremely loud and they're disruptive to patients as well. So we did a comparative video, a quick, I think it's about 40 seconds, that shows how loud this massage gun is. One thing that we specifically did is we wanted to bring down the loudness of the actual massage gun. We want to make it quieter so it's a better experience for your clients and for your patients. That's one of the kind of major differences between our product and the other products out there, is how loud the massage gun actually is. Another difference is we're more based on education. So for everybody that purchases a massage gun, gets a free introductory course as well. And during this webinar today, we're going to talk about how to actually go through those proper assessment and those proper treatment protocols so you can get the best results from your clients. Another product that we rolled out, which is really cool, and this is kind of close to me, is Canine Instrument-Assisted Soft Tissue Mobilization. So we have a new product that works really nicely. We use our typical MTT blade, and our small, we have a specific canine MTT blade as well. It's a very specific way to assess and treat canines. And this is a really cool product. I have a dog that's about 11 years old. He's a half Boston Terrier, half Chocolate Lab. By the time he got 9 years old, 10 years old, he had a problem walking up the stairs, and we kind of used massage gun plus our instrument-assisted soft tissue mobilization to treat those areas. Now, if this is your first time on our webinar or you haven't done our courses, that we do teach a tool, but we're all about movement. Our whole name is Myofascial Mobility Tool. Our whole goal is to create mobility within the myofascial system, whether you're using a stainless steel tool, whether you're using kinesiology tape, exercise, or the massage gun. Our goal is the same. We're just giving you a different tool how to get to your end goal. So our whole goal is to create movement, and we're going to talk about that today as well. Before we talk about massage guns, before we talk about different products, we're going to talk about assessment and how to get proper outcomes out of your assessment. So what you'll gain out of this webinar, so there's three major things that I want you to take out of this webinar. We're compacting a lot of information here, but there's three things I want to get. Just kind of the introduction of MyoStretch, what MyoStretch is, how you can apply the massage gun with fascial stretching, theory, application. Then we're going to talk about massage guns, harm or good, and how you can incorporate it into your practice. So before we start, we must know where to treat. Back to my story where I talked about when I went to that conference on the weekend where we had practitioners and trainers, they're just applying massage guns, charging 20 or 30 USD and applying the massage gun to the area. The patient will feel better. The massage gun, no matter what you do, it's a percussion therapy instrument. You will feel better after treatment. You're going to relax those muscles, bring more blood flow to the area, bring more oxygen to the area, so you'll feel better and you have a positive outcome. The difference between them and yourself is knowing exactly where to treat and getting long-lasting results out of your treatment. Anybody can apply this technique, but the reason why you guys are going to be able to charge more and be more of an elite practitioner is knowing exactly where to assess and where to apply the treatment with the appropriate manner. So our approach, we would take a three-step approach. And if you've taken our courses or webinars before, you've seen this quite a bit. So if you look at the very bottom here, it says assess, treat, correct. You cannot walk up these stairs without doing each step appropriately. If you go right to treatment, you'll fall flat on your face and you won't get those results. Like those practitioners that just apply the massage gun to the area, they're going to get short-term results. The patient will feel better, but they won't get long-term results. So we must assess, treat, and correct. When we use the massage gun, MTT blade, we're going to be looking into the treatment component. We're not going to talk very much about the corrective today. That's a whole other webinar that we do present. We're going to focus more on the assessment and the treatment with MyoStretch and the massage gun. So here's a typical, like we just talked about, here's a typical paradigm of what practitioners and trainers usually follow. So on the left-hand side, we see assess, treat, and correct. We want to spend a lot of time assessing, muscle testing, range of motion, going through movement. A little bit of time treating, a little bit of time correcting. If you know exactly where you need to treat and the cause of the symptoms your patient is experiencing, this is a very easy model to follow. Right now, if you look at the right-hand side, most practitioners and trainers, they spend a little bit of time assessing, a little bit of time of exercising, and they're always treating. Treating doesn't need to take that long if you know exactly where to treat. So let's start off with first our assessment. So assessment should be the cornerstone of any treatment program. So whether it's their first treatment or it's their 10th treatment, we always must do an assessment. We want to find out where they're moving, where they're restricted, and how we can make them move better. A treatment program should not just be based on one's capabilities, but their dysfunctions and limitations. So we want to look at what the patient can do and what the patient can't do. We want to see what their positives and what their benefits as well. Primarily, we do this because we want to have that positive reinforcement. Treatment and therapy is not all about just having negative, looking at the negative and trying to get a positive. We want to always have that positive reinforcement so the patient feels good about what they're doing as well. Once we figure out the assessment, we go into our treatment. We want to retrain movement patterns, follow unilateral work. Now, the number 3 is the most important step that we want to follow. Mobility, stability, strength, and movement patterns. When we find our assessment, we take our information out of that assessment, we want to create mobility within those tissues first. So we want to find out what's not moving and make it move better. For example, if someone comes into your office with knee pain, we don't want to treat the site of pain. We want to find out what's causing the knee to have too much range of motion and that laxicity and work on those joints. Typically, with a knee issue, it's going to be the ankle and the hip. So we want to create mobility between the ankle and the hip. Once we loosen up those tissues on the ankle and the hip, we want to look at the stability of the knee, create that stability within the knee. And whether you're using the amputee blade, massage gun, kinesiology taping, there's different stuff that you can do to create mobility, to create stability. Once you create mobility and stability, we'll look at strength. We're creating that strength so this does not come back. Then we're going to look at our movement patterns. We're always going to start with soft tissue, joint, and then kinesiology taping. In our third step, so we did our assessment, we did our treatment, and now it's going to be our corrective. So our third step is the correctives. These are the exercises to help create long-term results within your clients. These are simple exercises to re-engage those muscles and re-engage those movement patterns. Typically in our course, we talk about agonist-antagonist training techniques. So we want to really turn on that light switch with those neurological firing and get better results with those clients. So like we talked about, we want to create mobility before stability. We want to find out what's not moving and make it move better. Like we saw, if someone has, we talked about the knee. Now, if someone has shoulder issues, we want to find out what's creating that pain within the shoulder, whether it's the cervical spine, thoracic spine, lumbar spine, create mobility between those joints, and then we can have that stability between the joint that's not working very well. So what is mobility? So mobility is the ability to move freely without limitation to normal range of motion. Like we talked about a couple times already, is the knee with the ankle and the hip. Everybody's going to have restricted mobility. It's our job to find out what's not moving and make it move better. So this is going to also be prevention, and it's going to also be rehabilitation. If you're a practitioner or a trainer that's on this webinar right now and you work with a lot of prehab or rehab or even prevention, the person or the patient does not need to be in pain to have mobility issues. Their brain cannot know what's going on, or it could lead to an injury. So if you're doing an assessment, our assessment is not just based on the injury, it's based on what's not moving. Our whole goal is we don't care what the injury is during that assessment. We want to find out what's not moving, can move better. Once we create that blueprint around what's happening in the human body, then we can go into our orthopedic testing, our range of motion, and our muscle testing around that specific pain area to find out what's going on and create a better roadmap of how to treat it. So pain, what is it? How does our brain perceive it? So a lot of times we just add this slide in because a lot of patients will come in with pain. So for example, we'll talk about tennis elbow. A patient comes into your office and they complain of tennis elbow. They want you to treat the elbow. Now there is a certain customer care that practitioners and trainers need to follow as well. 9 times out of 10, loud epicondylitis or tennis elbow stems from the thoracic spine. If your patient or client has kyphosis at the thoracic spine, they're going to have what's called an inward rotation at their elbow. It's going to put a lot of stress and dysfunction off that elbow. So no matter how much massaging, acupuncture, blading, cupping, massage gun that you're performing, that's going to keep coming back. So we want to create that mobility at the thoracic spine to create long-term results. But then again, we still need to treat the site of pain. I know there's a lot of articles and there's a lot of guys online that say don't treat the site of pain. There's still a customer service aspect we still need to follow. There's still pain within the elbow. There's still limited blood flow, so we can create some better blood flow, better oxygen, so we decrease the pain in the elbow. That pain may come back if you don't treat the other mobility issues that patient is seeing. So we always want to create that. We always want to treat the pain, but also find out what's going on to create that pain. So let's go. We're not going to spend too much time on this right now. We're going to kind of talk about our dynamic movement testing. I know if you're on this webinar, you might have seen this in the past, but it's good to refresh. It's good to see this stuff here. So as our assessment, which is our first step, dynamic movement testing is form predicts function. So whether you're squatting, lunging, straight leg raising, thoracic mobility work, your form is going to predict the function. If you don't move very well, you're not going to function very well in everyday life. We always teach the squat and how to look at the squat. The reason why we do that is because we squat in everyday motions. Whether you're walking up the stairs, sitting on the toilet, or getting in your car, you always do a squatting motion. In our live seminars, we have everybody always stand up. And we tell them, try to sit down in your chair without doing a squatting motion. Besides falling down or falling over, it's impossible to do properly. So whether you have a patient that is a NFL running back or a 90-year-old lady who just wants to feel better and move better as she moves through her house, we need to assess the squat. Have them squat, create mobility between their ankle, hip, and knee. So mobility before stability. So when we're going through these tests, we want to find out what's not moving and help and make it move better. So again, we're finding out where the restrictions are. We also want to find out what's moving very well so we can have that positive reinforcement with our patient. We can help them feel better and move better at the same time. So let's go into the MyoStretch. So MyoStretch is a new program that we developed. This is a massage gun and stretch program. So if you're a trainer, you can do this on the gym floor. If you're a therapist, you can do this in the treatment room. It's a great adjunct that we developed that blends fascial stretch and the massage gun together to get better results. So what is MyoStretch? So the human body works together as an intricate system of our kinetic chains, including muscles, ligaments, and fascia. When we experience pain, there's a lack of mobility somewhere in the kinetic chain, causing poor movement and compression on blood vessels and nerves. So there's two things that the body does not like, or the nerves don't like. They do not like compression or stretch. So if you have a compression or stretch of a nerve, that's going to cause pain and dysfunction. MyoStretch therapists assess the fascial myokinetic chains through GOT and apply a global approach through dynamic hands-on stretching and eliminate mobility blocks, provide immediate relief and better mobility through a 30 to 60-minute hands-on session. So the way MyoStretch works, like we talked about, is our 3 steps. The therapist or trainer first does the assessment. They go through our 7 steps of assessment. Now you can add in always your own assessments as well. Once they do the assessment, they're going to go through a general stretching pattern that's going to test the integrity of the fascial chains and find where those blocks actually are. Once we find where those blocks actually are, we can apply a little bit of GOT, which is oscillation through the tissues, along with massage guns to break up that ground substance and open up those fascial chains. So the myokinetic therapist spends 30 to 60 minutes per treatment with a client. Treatments are commonly done on the gym floor in pre-treatment to adjustments, empty blade, or massage and physical therapy. We use a combination of massage gun and fascial stretch to improve range of motion and decrease pain. So massage guns, good or bad? So how they can actually work. We're going to talk about how these products actually work. So massage guns or handheld percussion massagers are designed to aid in the increase of blood flow in the myofascial release process. If you're in a course, I'd say underline that line. They aid in the increase of blood flow and myofascial release process. They don't create that change, they aid in the help. These handheld devices use vibration or pulsation to apply concentrated pressure deep into your muscle tissues and promote recovery. This form of deep tissue massage can work out knots and tension out of the muscles while also enhancing range of motion and increasing blood flow. Percussion massagers, when used correctly, can help reduce recovery time and help relieve pain, tension, and soreness. So let's go back a few steps. How it actually works. We just showed 2 slides that shows why it works. Let's go the actual science how it works. So the ground substance of extracellular matrix is an enforced gelatinous material. It is transparent, colorless, and fills the spaces between fibers and cells. It actually consists of large molecules called GAGs, which link together to form even larger molecules called proteoglycans. Elastin fibers allows tissues to stretch, thereby helping to absorb shock. Fascia, tendons, and ligaments contain both collagen and elastin fibers. Ground substance is a viscous, transparent fluid like raw egg whites. It surrounds all the cells and is a part of our internal ocean. So with that ground substance, if we have an injury, you don't have that range of motion going through the area, that ground substance actually gets hard and helps limit our range of motion. So here's a quick little picture of how fascia is actually made up. So the fascia, the cells, fibers, extracellular matrix, and water. So how fascia is made up. So connective tissue collagen is laid down and models align lines of stress. Fascia is 9 times more proprioceptive in fascia than muscle. Rhythmic motion, walking or cycling weakly stimulates fascia, whereas loading strongly stimulates it. Myofibroblasts, that's why, going back, so that's why if you work with elderly population, they need to do weight training, they need to do weight-bearing exercise to help strengthen, help prevent injuries. Myofibroblasts are stimulated by mechanical means and not through the nervous system. Fascia is organized according to the forces received and transmitted through the body. So again, if someone's not moving very well, we'll find them go through our 7 steps of our assessment techniques. If we have a client or patient that's not moving very well, their body will realign and remodel inappropriately, which could cause pain dysfunction along the lines or long term. So we want to break those patterns, find out what's not moving well, and recreate and re-educate. That's why step number 3, which is our corrective step, is so important, because we need to re-educate that patient how to move properly. So when their body is healing itself and remolding, it does it in an appropriate way and not in an inappropriate way that can help, it's going to create issues down the road. So fascia, ground substance, and massage guns. I know we kind of broke it up into 3 different things here. Let's put it all together. So when there's an injury, whether it's one that causes pain or doesn't cause pain, an injury could also mean that it's disrupting how the person moves or how your patient moves, which can remodel and realign that fascia improperly. So when there's injury, dysfunction, or limitation, remodeling will occur and ground substance will become dense. We don't want to become dense because that's going to lead to further injuries down the road. This will lead to pain, decrease in range of motion, and decrease in strength. So how do massage guns come into work? So if you look at the MTD blade massage gun, they're also called percussion therapy or vibration therapy. Percussive therapy is a form of soft tissue manipulation intended to reduce muscle soreness and increase range of motion. Even though some people refer to percussive therapy as vibration therapy, most percussive therapy devices actually use a hammering or thumping movement in addition to vibrations. Some models also use circular motions and often vary on speeds and pressure. The main purpose of percussive therapy isn't actually massage. Instead, it aims to mask and override pain signals to your brain, which will make you feel as if the soreness is gone. That's why when I talk about people are working and they're doing those quick massage sessions, they're going to help their client feel better because we are going to just be blocking the pain. It's not going to be long-term results. It's going to be very short-term results, but the patient will feel better immediately as it will increase blood flow and override those pain signals to the brain. It's also just going to bring more blood flow to the area and break up that thick ground substance. Again, if we break up that thick ground substance and the patient's still moving improperly, it's going to come back to where it was before. Everybody in here has had patients where they've had an injury, they experience some pain or discomfort, and they find it comes back right away. We typically and commonly see this with lower back pain. If a patient has lower back pain, they find it comes back every 4 to 6 months, the root problem is not solved. So that ground substance and that injury is still staying there. We're just overriding the pain signal to the brain so the patient feels better short term. It's going to always come back. Our goal as a business to help long term and help those patients feel better and move better so that treatment stays and doesn't come back. Percussion versus vibration. So the jackhammer effect to the tissues. We're going to bring greater blood flow to the area to help with healing and range of motion. So with the MTD blade massage gun, we're a percussion massage device. So we're not going to add vibration to the tissues. We're actually creating the jackhammer effect to break up that ground substance and reset the Golgi tendon organs. Can we break up scar tissue? No. So we're not breaking up any kind of tissue. Our whole goal is to kind of make molds the ground substance better, reset the GTOs, the Golgi tendon organs, help improve that range of motion. we also want to bring more blood flow to the area. So as we're going through the fascial stretch work, we can apply the massage gun to where we're quote unquote stuck, break up that ground substance, reset the GTO, and you get immediately better results going through your fascial stretch. So how we actually apply this to treatment. So step number 1 is going to be the assessment step. We'll go through our 7 exercises: the squat, inline lunge, hip lunge, straight leg raise, core, shoulder, and thoracic spine. Then we'll go through a quick fascial line tension assessment. We're going to go through the fascial lines, find out exactly what fascial line is stuck and where it's stuck. Go through our range of motion and our strength. Then we'll go through our tightness and apply the massage gun. So we'll go back through our number 2, which is going to be our assessment and our treatment. At the points where we're stuck, we're going to apply the massage gun through that area to break up the ground substance and improve that range of motion. So if you don't have a massage gun, I'm just going to do a quick little overview of how the massage gun actually works. So we have the top 3. We have a picture of the side view, rear view, and bottom view. Our massage gun comes with 4 different heads, with a flat pounding head, spiral head, spherical head, and a fork-shaped head. Depending on your assessment, you can use each different head for a different model. So I'm just going to go back and forth between each one here to kind of see the picture and what's going on. So for the flat head, which is this one on the bottom left here, it's for acute and large areas. So if you're working on the vas lateralis, the hamstrings, or the glutes, and they're having acute pain, we don't want it to be pinpointed. We just want to bring more blood flow to the area and reset those GTOs. So with the flat pounding head, we can achieve that results. For the spiral head is going to be the one in from the left. It's going to be for pinpoint and chronic. For example, if we're working on tendons or ligaments, or working on specific areas and we have a subacute chronic condition, we can be more specific and work on that area. From there, we have the spherical head, which is large areas and pre-game. So that's going to cause a little more stimulus to the area. And then our fork shape is for more where we have double muscle bellies. I like using the fork shape on muscles like the VMO, like the hamstrings, biceps, triceps. One that we want to work on the entire muscle and surround that muscle with the fork shape head. So a little bit of an example of how we can actually work this here is that we're going to go through our straight leg raise. So you can see that's one of our instructors on the using as a marker here in the blue shirt, and that's our patient through there. So we're going through what's called a straight leg raise. We want to differentiate if it's a tissue issue, neurological issue, or a joint issue. When we're going through the straight leg raise, we can apply a little bit of force, see the range of motion. Once we go through that straight leg raise, when taken to the end range of tissue, apply the massage gun for 20 to 30 seconds at point of restriction using the flat or spiral head. Then we'll go back into that active range of motion for that straight leg raise and assess the actual tissues of how we do it. So step 1 is we do our assessment. Step 2, we apply a little bit of overpressure, see where it's stuck. Step 3 is we're going to go through that massage gun. We can use the flat or spiral head to improve that range of motion. And then step 4 is when we reassess. Other techniques that we can do is the empty blade, which is a compression and mobility. We also have our mobility pods, which is our decompression. So mobility pods are like Chinese cupping. And then our taping, which is the reinforce and re-educate. So thank you for jumping on a webinar. I know it was quick. We have a lot of information there. We will be sending out this link plus a couple other videos for you guys as well. If you want the massage, we have a cool little promo. It's $349 plus tax, free shipping. With that, you also receive 3 rolls of custom tape, where you can actually put your logo and have it printed on our custom tape. We also have our introduction course, which is on September 6th. So forget about $399. It's $349 plus tax, free shipping, 1-year warranty, 3 rolls of tape, and you get the introduction course as well, which is completely and 100% online. Thank you for joining us today. If you do have any questions or want to get started with that model, just email us at education@mcblade.com, and one of our support staff will help you out right away. Thank you and have a great day.